Are you confused about aspirin? I know I am. Hello, I'm Dr. Nick, the Incrementalist, and today we're going to break down the two large-scale aspirin studies and what they mean to you. If you watched my video from the last time, you'll know this is a complicated space. Like many things in life, rarely straightforward with a simple yes or no answer. In fact, the first video, I featured a review of the aspirin to reduce initial vascular events in patients at moderate risk of cardiovascular disease, or ARIVE for short. The guidance for people under the age of 65 remains the same. From this study, as I discussed before, differing opinions and guidance, you're going to have to be thoughtful about the discussions with your doctor, weighing the potential benefits of cardiovascular and cancer prevention in the context of your own personal health profile, bleeding risk, preferences, costs, and other factors. Other studies have shown a reduction in heart attacks, and with the new data coming from this study, it's a complex calculus balancing all the potential benefits and risks. The added data and the additional splash of coverage has caused more concern and panic, as evidenced by my mother-in-law, who heard one of these news reports and was immediately concerned since she's taking aspirin on the basis of guidance from her clinician. She's not alone. There's widespread use of low-dose aspirin in the elderly population who do not have a medical indication for taking aspirin. People who have a history of heart disease or stroke have a medical indication for taking aspirin. But what if you don't have any health reasons to be taking aspirin? This was the question posed: do the benefits of taking low-dose aspirin outweigh the risks in this age group? This study, the Aspirin in Reducing Events in the Elderly trial, or ASPREE for short, ran from 2010 to 2014, with the analysis and data collection extending to 2017. They were specifically looking at the elderly population, 65 to 70 years or older, who had no signs of cardiovascular disease, dementia, or physical disability. They looked at the risk-benefit ratio of taking a low-dose aspirin. Did the risks of taking the drug outweigh the benefits to these individuals and produce better health outcomes? In this case, measured by disability-free survival. What did it show? Well, for the population over 70, the use of low-dose aspirin did not prolong disability-free survival. Hence all the coverage. The media is generating a lot of questions and concerns amongst a population already challenged with managing their health and wellness, and all the family members who are involved and concerned about their elderly relatives. So what are the incremental steps to finding your way out of this morass? Step 1, as they said in The Hitchhiker's Guide to the Galaxy, don't panic. As I said the last time, this is a complex area, and it's even more complex given these two new studies and additional conflicting data. But the good news, comparatively speaking, aspirin is a relatively safe drug with a low incidence of side effects. So you can use time to educate yourself to be able to make an informed decision. Educate yourself on the two studies. You'll find links to these, ARIVE and ASPREE, in the notes. I've also included some links to commentary from NPR Health on the elderly population ASPREE, and a piece in the New York Times on the ASPREE study. And there are some links on the ARIVE study from the Lancet and Medscape. Step 2. If you're over the age of 65 and taking aspirin and have no history of a medical condition that would indicate you should be taking this, I suggest you book an appointment to discuss this with your doctor. Step 3. For the younger population, as I said before, if you fall into a category of potential risk for heart disease, book an appointment to discuss aspirin as part of your overall health plan. As Yoda put it, dark side clouds everything. Impossible to see the future is. Hopefully, some simple steps to get you on the path to making the right decision on taking aspirin for you. Can I ask a favor? If you like this video, please subscribe to the channel And if you don't, leave me your feedback and thoughts. How can I improve things? Until next time, I'm Dr. Nick, the Incrementalist. Don't let perfection stand in the way of progress.